What's going on, world? Welcome. You guys already know what we're doing today. We're doing NCLEX questions. Hey, how y'all doing? Today is Monday. Y'all already know we ain't playing no games. Hey, so it's actually come to my attention. That I've been a little mean. To y'all. So I'm going to not be mean to y'all anymore. I know. You guys are a little bit sad about that. Apparently, I've been mean. Jana, homie, my Bessie with the Tessie, ma'am. How are you? You know I love you so much. Hey, I've been getting told I've been mean, so I gotta chill out. All right. But I'm gonna tell you who I'm not gonna chill out on. People that come up here and that play games with me. All right. What's up, Ebony? How are y'all? Hey, you guys already know what the deal is. Hey, I need 1,000 likes. I need 100 people in here. That's what I need. We ain't going nowhere until I have both of those. Trust and believe me, we are still in the month of January, so we boycotting everywhere. So I'm just letting y'all know. Hey, but of course, if you're new here, we're about to do NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, what are you doing here hanging out with us? My Bessie with the Tessie, Miss Jana's out here. She got a Tesla. She needs to let me drive it. You know what I'm saying? Do you help with anatomy and physiology? I mean, I can, but I don't. Specifically to that. I only specifically really focus on NCLEX. Hey, we got 140 something people up in here. I need another 500 likes. Is it Goldie Love? What's up, ma'am? How are you? Hopefully everybody had a really good weekend. Gina says NCLEX for March 1st. Hey, I know that's it. I know that's right. 4 months until you graduate. Okay. All right. Hey, I appreciate everybody jumping up in here, but I need 1,000 likes. I need all 200 of y'all to get carpal tunnel for me. And that way I can I got all these questions right here that need all this love. Chan, how are you? We need an aggressive attitude for NCLEX. CC, all right, I'm just saying, I'll give it to you. You know what I mean? We'll give it to you. So Mills says taking NCLEX on Wednesday. How did you study anatomy and physiology? YouTube, and it's tons of memorization. So I'm just letting you know that's how you study. Anatomy and physiology is memorization. Farm is killing my group. Farm kills just about everybody, all right? So here we go, ladies and gentlemen. You already know what the deal is. We're doing NCLEX questions. Welcome to this Monday of us doing TikTok live. So, of course, if you guys have any questions, comments, concerns, drop them down in the comments below. I want to know who you are, where you're from, where you're at in your journey. And here we go. A nurse is evaluating a post-operative patient and notes a moderate amount of serous drainage on the dressing 24 hours after surgery. Which of the following is the appropriate nursing action? Notify the surgeon about evidence of infection immediately. Leave the dressing intact to avoid disturbing the wound area. Remove the dressing and leave the wound site open to air, or change the dressing and document the cleaning appearance of the wound site. What are we thinking? Ladies and gentlemen, welcome. Hey, I got these questions off nurseslabs.com. They're free sets of questions. Make sure you guys go over there and check them out for yourself. If you are in nursing school right now and you haven't shared this to your cohort that you're in cahoots with and all the other stuff, you're wrong. You're wrong, and I'm going to need for you to fix yourself. So stop being greedy. There's enough of Kevin to go around, you know what I'm saying? So share it to people. Stop being greedy, all right? Also, I want to know who you are, where you're from, and where you're at in your nursing journey. What's up, Kari? How are you? Here we go, y'all. Here's our answer in 3, 2, and oops, just kidding. There we go. And the answer is D. Change the dressing and document the clean appearance of the wound site. Shout out to everybody that got that right. A moderate amount of serous drainage from a recent surgical site is a sign of normal healing. Serous drainage is clear, thin, and watery. The production of serous drainage is a typical response from the body during the normal inflammatory healing stage as part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. I shared to all my Facebook group. I love Teresa. I appreciate you. There goes Grace. Grace, I see you. Hey, so that's the 4th largest section on the NCLEX reduction of risk potential. Okay, so make sure you guys understand. When you guys understand where the questions come from, it's not new news to you. Okay, it's not new news. Here we go. Question number 2. A patient returns to the emergency department less than 24 hours after having a fiberglass cast applied for a fractured right radius. Which of the following patient complaints would cause the nurse to be concerned about the impaired perfusion of the limb? Okay, so paint the picture, right? What's going on with this cast on my extremity? All right. Is it severe itching under the cast, severe pain in the right shoulder, severe pain in the lower right arm, or increased warmth in the fingers? What are we thinking? Shout out to everybody that's out here. Shout out to all, if you're all new here. Hey, we're on the road to 10,000 likes. If I get to question number 10, and if I don't have 10,000 likes, y'all ain't getting no more questions. There, I said it. There's my aggressiveness for the day. But no, hey, on the road to 10,000 likes, all right? Make it happen, all right? Don't be coming over here being greedy. Keyword is fiberglass. Who said that? He says, hey, I graduated nursing school and I take my NCLEX soon. Shout out to you, Liz. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is C, severe pain in the right lower arm. Impaired perfusion to the right lower arm as a result of closed cast may cause neurovascular compromise and severe pain, requiring immediate cast removal. When there is an increase of compartmental pressure, there is a reduction in the venous outflow. This causes venous pressure and thus venous capillary pressure to increase. If the intracompartmental pressure becomes higher than arterial pressure, a decrease in arterial inflow will also occur. The reduction of venous outflow and arterial inflow results in decreased oxygenation of tissues, causing ischemia, which is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. So shout out to everybody that got that right. Remember, when you guys are studying, you guys need content, you need Q&A with your rationales. Everything goes full circle. I call that, TBN 360. Everything goes full circle. And guess what? If you don't understand the rationales, I don't care if you understand the rationales. And if you don't like them, that's fine. Guess what? You're going to go right back to content and you're going to figure out why you got that answer right or even why you got it wrong. Okay. So here we go. Question number 3. An older patient with osteoarthritis is preparing for discharge. Which of the following information is correct? All right. So what is the correct thing that we are doing for this patient or that they're telling us that they're going to do? Increase physical activity and daily exercise will help decrease discomfort associated with the condition. Joint pain will diminish after a full night of rest. Non-steroidal anti-inflammatory medication should be taken on an empty stomach. Acetaminophen or Tylenol is a more effective anti-inflammatory than ibuprofen. What are we thinking? Shout out to all 300 plus of y'all out here rocking with me. Make sure you guys like, make sure you guys share, make sure you guys follow. Also, if you're new here, I want to know who you are, where you're from, where you're at on your nursing journey. If you're not a nurse, what are you doing here hanging out with us? A little bit about me. Been a nurse for 3.5 years. I've worked ICU, specifically in a burn ICU and a medical ICU, floated to neuro, worked OR, as well as worked in PACU. So that's a little bit about me. I'll tell you guys more as we go on. So here we go with our answer. Everybody's screaming. Well, most people are screaming A at me. So, okay. All right, Shelby, you ain't got to scream at me. Lord. Are you still a nurse? I just told you that. I literally just told you that. So, hey, here's the thing. Once you're a nurse, you're always a nurse. It doesn't matter if I don't work bedside. You know what I'm saying? I still have a licensed practical nurse, RNs. You have a license, you're always a nurse. Just because you're not working bedside doesn't mean that you're not a nurse. All right. So make sure I need for y'all to understand it as y'all go on. Here we go. And the answer is A, increased physical activity and daily exercises will help decrease discomfort associated with the condition. Physical activity and decreased exercise can help to improve movement and decrease pain in osteoarthritis. Exercise programs that combine both aerobic and resistance training have been shown to decrease pain and improve physical function in multiple trials and should be encouraged by physicians regularly. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section, but still very, very much important. It's still part of the 8 client needs, which it's part of the 8 client needs that the NCLEX wants you to know according to the test plan. All right. Hey, here's something funny. Did you guys know that the NCLEX pass rate for first-time test takers for the year 2023 was 88.67%? In case you didn't know that, now you do. Here we go. Question number 4. Which patient should not prescribe Fosamax for osteoporosis? Is it a female patient being treated for high blood pressure with an ACE inhibitor? Is it a patient who is allergic to iodine or shellfish? Is it a patient on a calorie-restricted diet or a patient on bed rest who must maintain a supine position? What are we thinking? What are we thinking? Hey, I got these questions off nurseslabs.com. They're free sets of questions. Make sure you guys go over there and check those out for yourself. Make sure you guys smash that like button, you guys share, and you guys follow. That's the trifecta that TikTok needs. And I need for y'all to follow and I need for y'all to share, because the more people we get this out to, the better. The more we share this knowledge. Everybody's screaming D at me. I'll give you 10 more seconds. Sharonda says, I'm an LPN for 7 years, taking HESI on Friday for Bridge in Illinois. Shout out to you. I start orientation. Lactation counselor. Shout out to you. Is it Demarma? Shout out to you. Everybody's screaming D. Here we go. Here's our answer. Shout out to the gang. I see you out there, big dog. Here we go. Here's our answer. And the answer is D, a patient on bed rest who must maintain a supine position. All right, Fosamax can cause significant gastrointestinal side effects such as esophageal irritation. So it should not be taken if a patient must maintain a supine position. It should be taken upon rising in the morning with 8 ounces of water on an empty stomach to increase absorption. The patient should not eat or drink for 30 minutes after administration and should not lie down. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 14 to 18%. Other places will say 13 to 19%. Regardless, it's still the second largest section, and I like to call the killer because it is the killer. You know what I'm saying? So make sure you guys understand that. Somebody said easy questions, but so easy to make you overthink. Yeah. I had a coaching session with somebody like that yesterday, and they were just like, yeah, that's the answer. I was just like, are you sure? And the answer was completely wrong. So there you go. Make sure it may be easy, but it may be easy to you, but it may not be easy to others because everybody that is in this live is in a different position. You know, some people are just starting. Some people haven't even started and interested. So you got to meet people where they are. It's all growth from there. All right. Here we go. Question number 5. Which of the following strategies is not effective for the prevention of Lyme's disease? Is it insect repellent on the skin and clothes when in a Lyme endemic area? Long sleeve shirts and long pants? Prophylactic antibiotic therapy prior to anticipated exposure to ticks, or careful examination of skin and hair for ticks following anticipated exposure. What are we thinking? Shout out to all 400 of you guys out here rocking with me. Something else about me. I did 16 years and 4 months in the Navy. I just recently got out on the 6th of January. I was an instructor, a master instructor in the Navy. I taught surgical technology, ABLS, ACLS, pre-hospital trauma. I'm a trauma nurse instructor now. So I've been teaching for the last 9 years. So yeah, this is why I do TikTok. I like to teach you guys, like to, come out here and, do a little something for the folks. So I love teaching. It's no longer a passion. It's actually an obsession. Like, it's overly obsessive. It's kind of crazy. So appreciate everybody. Shout out to everybody. Former hospital corpsman here. Shout out to you, Just Erin. Here we go. And the answer is C, prophylactic antibiotic therapy prior to anticipated exposure to ticks. Shout out to a 10-year new RN. Shout out to, is it Raquel? Shout out to you. Prophylactic use of antibiotics is not indicated to prevent Lyme disease. Antibiotics are used only when symptoms develop following a tick bite. Specific treatment is dependent upon the age of the patient and stage of the disease. For patients older than 8 years of age with early localized disease, doxycycline is recommended for 10 days. Patients under the age of 8 should receive amoxicillin, or was it ceforazine. There we go. For 14 days to avoid the potential for tooth staining caused by tetracycline used in young children. That's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Third largest section. Top sections: management of care, farm, physiological adaptation, reduction of risk potential. Hey, if I don't know how to say things right, sorry. I'm just letting y'all know. Hey, ladies and gentlemen, I got a couple things that are on here. Hey, if you're looking for a free download, some tips that'll help you conquer the NCLEX, you can check that out. That link is in my bio. It's a free download. You can check that out. Also, I have an ebook, because remember, the path to conquering the NCLEX begins with you. Anybody looking for an NCLEX course that you get for a lifetime, for now, you can check it out. That link is in my bio, or it's at thebootnurse.com/special. Also, if you're one of those individuals who needs one-on-one mentoring, coaching, and guidance when it comes to the NCLEX, you can check it out, thebootnurse.com/coaching. So shout out to all y'all for hanging out with me today. Question number 6, the nurse is performing a routine assessment of an IV site in a patient receiving both IV fluids and medications through the line. Which of the following would indicate the need for discontinuation of the IV line as the next nursing action? So what's going on? Like, what's wrong? What's happening at that site? All right. The patient complains of pain from movement. The area proximal, right? Proximal, which is going towards the heart. Right? Proximal, which is going towards the heart. Insertion site is red and warm and painful. And IV solution is infusing too slow, particularly when the limb is elevated. A hematoma is visible in the area of the IV insertion site. What are we thinking? Somebody's telling me B or D. You got to give me one. Natalie, you take your NCLEX on Wednesday. Shout out to you. Well, I fully expect for you to come back on Friday to tell us how you did. But you're thinking B, man, you got to think an answer, one answer, and you got to give it to me. So what are we thinking? Shout out to y'all. Get me to 13,000 likes. Hey, we're on the road to 20. On the road to 20,000 likes. Is it Maya? You take yours on Thursday? Maya, y'all are going to be all right. Y'all are going to be okay. Trust and believe me. All it is, trust me when I tell you, it's all a test. All a test. Thank you for not having a monotone voice. Jazzy, hey, just because you said that, I'm about to read this answer monotone. All right, y'all ready for it? Here we go. Here's our answer in 3, 2. And the answer is B. The area proximal to the insertion site is reddened, warm, and painful. The IV site that is red, warm, and painful and swollen indicates that phlebitis has developed and that the line should be discontinued and restarted at another area. Phlebitis is inflammation of the vein. It is usually associated with acidic or alkaline solutions or solutions that have a high osmolarity. Phlebitis can also occur as a result of vein trauma during insertion, use of an inappropriate IV catheter size for the vein, or prolonged use of the same IV site that is part of pharmacological parenteral therapy, second largest section on NCLEX at 11 to 17%. Hey, I just want to let y'all know that was literally probably one of the hardest things I had to do because I was smiling the whole time. So, hey, that's what you get. All right, hey, I'm just playing. Hey, here we go. But shout out to everybody that got that right. It's B. Oh, hey, I'm surprised I went that long too because man, I was holding a smile the whole time. Why you do me like that, Jazzy? Look, I'm sorry. I can't be monotone. That was very difficult for me to do. But hey, I'm glad I could give y'all a laugh here on this Monday. Here we go. Question number 7. A hospitalized patient has received a transfusion of 2 units of blood over the past few hours. The nurse enters the room to find the patient sitting up in the bed, dyspneic and uncomfortable. On assessment, crackles are heard in the base of the lungs, probably indicating that the patient is experiencing a complication of transfusion. Which of the following complications is most likely the cause of the patient's symptoms? Is it febrile non-hemolytic reaction, allergic transfusion reaction, acute hemolytic reaction, or fluid overload? What are we thinking? Hey, so here's something else that's new, or something else for everybody that's new here that doesn't know. I failed my NCLEX 3 times. Not once, not twice, but 3 times. All right. And let me tell you something right now. No job cares. Nobody cares. No job cares. No recruiter cares. Nobody cares. So for all those that were unsuccessful at the exam, that exam does not determine what type of nurse that you are going to be. I don't care what anybody tells you. I don't care what any rogue nurse or some nurse that think that they're better than you is going to tell you. I'm telling you right now, no one cares. Nobody cares. So, ladies and gentlemen, get out of your own way. Stop listening to these people that don't walk a day in your shoes at all. Get out here, study for this exam, make this money, you know what I'm saying? Take care of these patients and go about your business. Shout out to you, Reese. Reese, if you want to be a nurse, you better put the work in. You know what I'm saying? So that's my little tidbit for y'all. Here we go. And the answer is D. It is fluid overload. Fluid overload occurs when the fluid volume infused over a short period is too great for the vascular system, causing fluid leak into the lungs. Symptoms include dyspnea, rapid respirations, and discomfort as in the patient describes. Transfusion-associated circulatory overload includes any 4 of the following occurring within 6 hours of a blood transfusion. It's acute respiratory distress, tachycardia, increased blood pressure, acute or worsening pulmonary edema, and evidence of a positive fluid balance. That, of course, is pharmacological and parenteral therapies. Blood products blood is medication, which is why it falls under pharmacology. All right, so I don't need for anybody to get that confused. I'm not a nurse and I got it right. I don't know what you mean. What do you mean? Is it cushy sing? I mean, I'm glad that you got it right. Hey, come out here and be a nurse if that's what you're trying to do. Hey, but pharmacological parenteral therapy is 14 to 18% on the NCLEX exam. Somebody said, do you have any advice for the T's? Get the Yellow Metrics book, study it for a month. Gucci. I'm a healthcare. Oh, you're a healthcare aide. Shout out to you. Hey, come on here and be a nurse. Hey, so these questions could be easy, but it all just depends on where you are and your knowledge. Remember, when you come from being a patient care tech and then you want to become a nurse, it's not necessarily about the how, it's about the why and how to apply. Using critical thinking, applying that to make a clinical judgment. Okay, here we go. Question number 8. A patient in labor and delivery has just received an amniotomy. Which of the following is correct? Select all that apply. All right. How did you prep for HESI? You talking about the entrance? Same thing. Get the Yellow Metrics book, study for a month. All right. Here we go. Frequent checks for cervical dilation will be needed after the procedure. Contractions may rapidly become stronger and closer together after the procedure. The fetal heart rate will be followed closely after the procedure due to the possibility of core compression. The procedure is usually painless and is followed by a gush of amniotic fluid, or the procedure is without pain. What are we thinking? Shout out to all 300 plus y'all out here rocking with me. If you guys are new here, welcome. We're doing NCLEX questions. We're on the road to 20,000 likes. Apparently people got tired. So I'm going to need for y'all to get y'all second wind and, make it happen. Also, I got these questions off nurseslabs.com. They are free sets of questions, so you can go over there and check those out for yourself, especially if you're in nursing school. Also, if you're in nursing school, they have great care plans. I used them in nursing school. Other people have. Don't let these people at school, and by people, I mean your instructors, lie to you and say that it's cheating, because some of them would be like, that's cheating. That's just like saying, hey, use AI to write your research papers. Yeah, you heard me. You heard me say it. Here we go. So we got BCD. A is infection risk. Okay. ABC, ABCD. Okay. All right, y'all. Here we go. Here's our answer. Here is our answer. And 3, 2. And the answer is B, C, D, and E. Uterine contractions typically become stronger and occur more closely together following an amniotomy. The fetal heart rate is assessed immediately after the procedure and followed closely to detect changes that may indicate core compression. The procedure itself is painless and results in the quick expulsion of amniotic fluid. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Remember, when you guys are studying, you need content, you need Q&A, you need rationales. Content allows for you to learn it, you apply it, and then you retain it. Learn, apply, retain. Learn, apply, retain. All right, that's what it is. All right. So here we go. Question number 9. A nurse is counseling the mother of a newborn infant with hyperbilirubinemia. Say that like a million times fast. Which of the following instructions by the nurse is not correct? So what did the nurse say to the patient that was inaccurate, that was wrong? So 3 of these answers are going to be correct. And those are the 3 that you are not going to pick, right? So one of those is going to stick out and be like, girl, what you talking about, right? So here it is. Continue to breastfeed frequently, at least every 2 to 4 hours. Follow up with the infant's physician within 72 hours of discharge for a recheck of the serum bilirubin and exam. Watch for signs of dehydration, including decreased urine output and change in skin turgor. Or is it D, keep the baby quiet and swaddled and placed in the bassinet in a dimly lit area? What are we thinking? What are we thinking? Hey, by the way, if you passed NCLEX, I had a bunch of people, like 5 or 6 people on Friday before we even started tell me that they passed NCLEX. So, hey, if you passed NCLEX, let me know. That way we can give you your flowers. Hey, this is the community that that we are building around here. Not just me, I say we. That is what we're trying to build around here. Nothing but positivity, like-minded individuals that are trying to one goal and one goal only. And that is to be a nurse and go beyond that. That's what I'm trying to tell y'all. So shout out to y'all, everybody that took their NCLEX, everybody that's passed, everybody that's preparing for the NCLEX. You guys got this. Hey, if anybody around here starts talking nonsense to y'all, come find me. Come find me. I got some good words for you. All right. Nobody ever knows what it's like to take this exam unless you actually sat and taken it. All right, here we go. And the answer is D. Keep the baby quiet and swaddled and place the bassinet in a dimly lit area. An infant discharged home with hyperbilirubinemia, which is newborn jaundice, should be placed in a sunny rather than dimly lit area with skin exposed to help process the bilirubin. Phototherapy is started based on risk factors and serum bilirubin levels on the nomograph, right? So that is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam, ladies and gentlemen. All right, there are 8 client needs. This is a smaller section, but a very, very important one. For all my people that have failed the NCLEX, you guys know what those performance breakdowns look like. You see what I'm saying? And management of care, health promotions and maintenance is one of those categories. All right, here we go. Question number 10, a nurse is giving discharge instructions to the parents of a healthy newborn. Which of the following instructions should the nurse provide regarding car safety and the trip home from the hospital? The infant should be restrained in an infant car seat, properly secured in the back seat in a rear facing position. The infant should be restrained in an infant car seat, properly secured in the front passenger seat. The infant should be restrained in an infant car seat facing forward or rearward. Why not backwards? But whatever. Rearward in the back seat. Or is it D, for the trip home from the hospital, the parent should sit in the back seat holding the newborn? Yeah, so y'all let me know. Also, if you're new here, welcome. I got these questions off nurseslabs.com. They're free sets of questions. Go over there and check them out for yourself. And also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? What are you doing here? All right, y'all, here's our answer in 3, 2. And the answer is A, the infant. Whoa, hold on. Whoa, oh yeah, hold on. Hold up. And the answer is A. Should be restrained in the car seat, properly secured in the back seat in the rear facing position. I was like, well, hold on. I was like, wait, which one are we not picking? All infants under 1 year of age weighing less than 20 pounds should be placed in a rear facing infant car seat secured properly in the back seat. That is health promotions and maintenance. Will this help with the new gen? Yes, it will help you with the new gen. Ask the people that have already passed. So here's the thing about the next gen NCLEX. The content is still the same. Shout out to Nova Scotia.